Psychosis is defined as a mental health disorder that disconnects you from reality. It can be a symptom of other mental health disorders like schizophrenia, bipolar, and severe depression. 12 to 23% of people experience psychosis at some point in their lives, but only 4% meet the criteria of having a psychotic disorder. Four main symptoms that a person usually has when they're experiencing symptoms of psychosis. These are delusions, hallucinations, thought disorders, and agitation. And I like to throw in aggression because that's one I notice in a lot of people I serve. This can lead to seeing things that are not there, hearing voices around you when no one is there, and there can also be unusual thought processes that you're experiencing that are not normal. Other factors can be acute stress, illicit use of drugs and alcohol. Prescription drugs like steroids can actually also cause psychosis. If you have a physical issue like a brain tumor, this can also lead to psychosis. So what are the treatments? Antipsychotic drugs can be used for somebody for about 2 to 3 years to have any sort of effect. There are also talking therapies like cognitive behavioral therapy. Another way is to try to improve the quality of a person's life that has these disorders. It's also important to try to get that person back to living a normal life. And a lot of times they can do that. Where on some hands, others need to be supported and continue to do therapy and continue to take the medications long after that. It depends on the person. A trauma history has also been linked to psychosis. It is between 30 and 50% actually of the people that have psychosis have some sort of trauma in their background. I know we always hear trauma and we always think, oh, that what happened to me before don't have a lot to do with me now. Trust me, it does. PTSD has also been linked to recent studies of psychosis. A lot of people hear PTSD and all they think about is military. PTSD stands for post-traumatic stress disorder. And it doesn't matter where that PTSD came from. It's just more known that people talk about it from the military. But any traumatic stress that you've suffered before that is not dealt with is post-traumatic stress. Genetics and biologics are also factors in psychosis as well. If a family member has been diagnosed with a mental illness in the past, it is likely that a person that comes after them can experience a mental health disorder like psychosis. A psychotic episode can be triggered from environmental factors as well. An imbalance in the brain's chemicals, such as serotonin and dopamine, can really be contributing factors. So a full assessment is necessary for anyone experiencing any of these symptoms we talked about. The assessment would help rule out any physical issues that you might be dealing with that may be triggering these responses as well. In order for you to get the right help, they got to know what they're treating. So if you or someone else might be experiencing psychosis, please don't hesitate to get the help that you need. There are hotlines, there are ways that you can get help in order to help deal with your mental illness.